when you're talking about relaxations, do you think that a mask mandate is still necessary?
So I think it's time to remove the mask mandate. And I have to be very clear with how I phrase my statement, right? So I think general masking, it's time to remove the general masking mandate. I think not mask, but medical grade mask and high filtration mask still have a role in healthcare facilities in specific areas where risk of transmission is higher, right? For example, the operation theater, the infectious disease ward, maybe even the outpatient, so on and so forth. But talking about general masking, I think from what we have learned, that number one, it's airborne, so that many of the masks we use are not useful, right? So if the transmission was truly airborne, we would need N95 mask or higher. Proper fitting N95 mask, not just wearing. I've seen many people wear an N95 mask, right? And it's loose and air goes in through the side and all over the place. If you really want the N95 mask to be working, it has to be properly fitting, and then you feel like Darth Vader when you breathe. You're like, right? Because it's difficult to breathe, but that's because the filtration is working. Now, the problem with N95 masks and many of these high filtration masks is they were never meant to be used for prolonged periods. So you can think of this, that if you were to use an N95 mask at workplace for about 8 hours, I think you would have fainted, or you would have like gotten shortness of breath, but just by using that mask properly. So what many of us do is we use non-medical grade mask, which had a role when we thought that transmission was droplet based. So the difference is, in droplet based, you can think of my spit coming out, you can think of my any of my nasal fluid coming out, right? You can think of my eyes, and we thought that was the major driver of transmission. So wearing a mask kept the droplets in my mouth, and then that prevented transmission. But now, because with newer information, with more evidence that it's airborne, then there's no role for mask. The effectiveness of general masking is very low because of low compliance. We must also think of cost, right? Cost not as money, but environmental cost. There is a huge environmental cost to masking, because many of us buy the disposable mask. We use once, we throw it away, and we don't care. We don't care where the mask goes. Actually, now, for the past 1 year, many people have used many masks and are not worried where it went, but it has to go somewhere. The plastic has been accumulating somewhere, right? So I think we have to think about environmental costs. We have to think about financial costs, right? The whole nation is actually masking when we need not have to anymore. I do say this for now. In the future, if there's a future variant, or if the situation changes, then my recommendation would change. But for now, for the near future that I can see, I don't see a masking mandate.
But it sounds a bit counterintuitive, and I think because psychologically we have been doing this and we've been told time and again that, wear a mask, it helps. Is there no benefit at all in the whole general masking in this period of time? Yeah,
I would think there was a benefit. The benefit was very, very small. So the point about, I'm talking about non-medical grade mask. I'm talking about, actually, you can think about non-N95 mask, right? I'm talking about the surgical mask, the fabric mask, so on and so forth. So for many of these masks, I think the effectiveness of it against airborne transmission is low. In addition to that, many of us, the way we have been, long-term use of mask had always been difficult. And the idea that you use a mask and then whenever you take it out, you hold it, you deal with it, I think the overall effectiveness would be very low. Now, the issue is we don't have real-world evidence. We do have modeling evidence, but the problem in modeling is assumptions. So I'm still looking out for real-world evidence on masking, and that's why there's been many nations that have sidestepped the masking mandate, right? Now, all said and done, there are different periods to this 2-year pandemic. What I would be saying is I would be very comfortable in periods where I think the transmission is not high, the transmission is low, I will be very comfortable with not having a general masking mandate. I think a general masking mandate would be like a last resort when transmission is very high, and you would want to do something.